friends. Welcome to our new podcast panel discussion. So, today we have our guests, Dr. Mohan and Dr. Nandan. Welcome our guests to this YouTube podcast.
Thank you so much, Dr. Sunil.
Thank you so much. Doctors, today we are going to discuss about the medical officers' working experiences and in Nepal versus Oman.
Okay, that's good topic.
Okay. So before starting, let me introduce. So Dr. Mohan is working as a medical officer for last 2.5 years in Oman, and he has already like years of working experiences in Nepal. And similarly, Dr. Nandan has recently joined Oman as a medical officer, but already had like 4 5 months of working experience. But one of the like best medical officer, let's say, already worked in Nepal. So now we are officially on the discussion. My first question to you, Dr. Mohan. So, can you brief about your background, working, brief about the medical background, and then after your working experiences in Nepal and in Oman?
Yeah, Doctor, thank you so much for inviting me this podcast. Okay. As a medical officer, I have been working in Nepal for around 5 years in Nepal, and then after I came here around 2.5 years ago.
Okay.
In Oman. But it's talking about the Nepal. I had worked there as a medical officer under the Ministry of Health and Population. It's quite good experience in Nepal. And then after since 2.5 years, I'm working in Ministry of Health, Sultanate of Oman, and I had a quite good experience as well here. What kind of differences or what kind of emphasis you want to know about Nepal versus Oman? Can you just specify the?
Okay, sir. Like, let's say if a new doctor who is deciding to work in Nepal or in like working in Nepal or wants to work in practice in Oman, and if listening to this discussion, then after like, can you brief about like the salary, the work experiences, the team experiences here in Oman, and then after uh, the overall like growth opportunities, so that one can differentiate whether to work in Nepal or in Oman.
Yeah, that's very good question, Dr. Sunil. Let me talk about the salaries and time and the vacation, everything about Nepal versus Oman. As I already mentioned that I had worked in Nepal for 5 years and here is 2.5 years. I got lots of differences. I noticed lots of differences between Nepal and Oman as you compared to Oman and Nepal. Just we have to work around 40 hours per week in Nepal. Just this is a official working hour.
Okay.
This is just official, but in case of Nepal, we had working more than hours, lots of hours. Even we have to
like
work
day and night.
30 hours in a day, even though we have 20 hours in a day. Okay. And
There's
it
no fixed
continues
duty
for
schedule.
week.
Right.
Okay. If you are the single medical of Nepal, you are 24 hours.
Okay.
It's very like you can imagine
And
how
like-
stressful life in Nepal
Oh.
as a medical officer.
Okay. So you said like more stressful in Nepal compared to Oman.
Of course.
More working hours in Nepal compared to Oman.
Yes.
So like in Nepal, 35 hours per week, then it can more than 40 hours in Nepal.
It's more than 70 hours,
Can
no
you-
more than 60
Okay.
hours
So can
per week in
tell them about the salary.
As we want to talk to about the salary in Nepal, you know, the government salary is just about 8 level
Okay.
salary around 48,000 now.
No.
But before it was like 40,000, sometimes 35,000. That's all. And you don't have no other salaries like overtime. If you do overtime, sometimes some like local government they'll provide with extra salaries. Sometimes they do not provide at all.
Okay.
And that's just a explanation of our uh, oh.
And in Oman?
In Oman, let's compare in Oman, we have just a 35 hours per week working out, exactly 35 hours. Even if you do 15 minutes more than that, you will get extra. You will get extra.
And like, can you tell me about the work life here compared to here, like in Oman,
Yeah.
compared to Nepal? In short,
Yeah,
doctor.
thank you for your questions. In Oman, we just have a 7 hours duty in a day. It
Okay.
lasts only for 5 days.
So you have
in a
better
week.
work-life balance here
Yeah,
in
of
Oman.
course, of course.
Okay.
After 7 hours, you are out of work. You can enjoy your personal life. You can enjoy family life.
Okay.
Okay.
So like it's shifting from one country to another country. There are like lots of barriers.
Yeah.
So obviously, like Oman is like Arabic speaking Islamic country.
Yeah.
So did you find any cultural or a language barrier while adapting in Nepal or Oman, or how difficult it was?
As a Nepalese doctor, it is a quite new experience for us to be in Oman. It's quite new. Okay. And we don't know the culture about it, and it's a like new experience. Sometimes totally different culture, totally different people, totally different language. Okay, but from my experience, Arabic is not that much like a difficult language to learn. Okay, in around 1 month, I can speak Arabic to my people regarding the health issues. I can take a history, proper history. I can manage a patient. That's not a big issue for us.
So are they supporting enough?
Of course, they are quite supporting. At the beginning, they're really quite supporting. The medical officer in charge is the head of the hospital. He's quite friendly. He's quite supportive. He also helps me to find the rent here.
Okay.
Even I don't have car here at that time.
Okay.
He provide me with the transportation by himself. He came to my room to pick up me.
So overall, you want to say that the work environment is supporting.
Yeah, of course, it's supporting.
Even while working as a medical officer inside a hospital,
Yeah.
you get supportive team.
Of course.
Okay. So thank you, Dr. Mohan, for your lovely and beautiful answers.
Okay.
So now,
Thank you so much.
okay, I'll ask some questions to Dr. Nandan. So, Dr. Nandan, like before moving on to the particular questions, can you brief about your medical background in Nepal, and then after I'll come with the questions. Okay, thank you. Thank you for inviting me here. First of all, namaste to everyone. Okay, namaste. Okay. Let me introduce myself. I am Dr. Nandan Kumar Shah. I am from Nepal and particularly Sira districts. Okay. I study MBBS from BPKHS Dharan. I passed out in 2020. After that, I started working as a medical officer and medical in charge in one of the primary healthcare centers located in the Udaipur districts. After that, it passed 5 years. How it passed, I don't know. Okay. So I was preparing for the PLAB. I got the GMC, but I was not getting any job, the good jobs in UK as well as in Nepal. So I heard from my friends that Oman is one of the best country to earn the money to get the experience. So I applied the form and I got selected and I'm here since November 2024 and I'm enjoying my life over here. Okay, glad to have you here, Dr. Nandan. Thank you. So now, so I already asked a few questions like in terms of salary, in terms of the how supportive the environment is, exactly, and also about the experiences regarding the how stressful or uh, the mind is while working in Nepal versus Oman. So, few questions to you. So, are you agree with Dr. Mohan? What he had, the experiences, or something different you found? Obviously, this is a simple thing. The whatever Dr. Mohan has explained is perfectly correct. Okay. Yeah, I 100% agree with his whatever he has told. But you see, different people have different approach. Okay. Yes, and let me tell my approach. Yeah, how I am feeling. Okay. See, there are different categories on which you compare the working experience in Nepal and Oman. If someone wants just money, then obviously payment is here more. Yeah. Okay. Like 10 times or 12 times more payment from Nepal than here in Oman. Okay. Regarding the cultural, regarding the like supporting environment, obviously Nepal, where we can't compare the Nepalese culture over here. Okay. Obviously, because see in Nepal every time fight and every time say political background issues, but here obviously here we don't have any such political issues. We are working in a simple environment, always the supportive environment. Obviously, in Oman. I'm not showing that the health background of Nepal and political background of Nepal is very bad, but we sometimes, most of the times, we are seeing the news of Nepal that some doctors are being what to say, like getting like beaten by public people.
Yeah,
Assaulted,
if
assaulted,
there's,
yeah,
if
exactly.
someone assaulted,
Assaulted.
the here the penalty is,
Okay.
if you inform the police right now, they'll come immediately, not like in Nepal.
Exactly.
Okay, and they will take that
Actions,
assault.
quick actions, yeah.
Quick response.
Yeah.
And if there's like some slapping or like a verbal abuse or like this,
Exactly.
they will penalize with 2,000 real.
Exactly.
That is
So
around
the work safety is better there. Yeah, exactly. That's what we used to say.
8 9 lakhs Nepalese rupees.
Yes. So work safety is better.
Very safety.
Now, like
Even the patient are not that much like a back to here. Some people, young people, they are sometimes they shout because of their angerness, but they don't raise the hand over us.
Yeah. They respect. They respect that.
Here is law is quite strong. They always follow the rules here.
Rules. Okay.
Unlike in Nepal.
Okay,
In
that's
Nepal, if you even you get
That's
beaten
good.
with some
Yes.
people with political background and power,
Okay.
they'll be like out of any charge.
Okay. So, in terms of work safety, it's like far better in Oman.
Far better,
Now I
yes.
have few other questions. And so most of the like medical doctors who are desiring to work in Nepal, so they want to know about like the career growth opportunity. Is it better in Nepal or in Oman? So
How do you think about
so thank you. This is a really good questions. Yeah, most of the doctors might have these questions that when I reach the Oman, what is my career? So actually, there is nothing career growth. Only we are coming here for our experience as well as the money. Okay. Though we are away from my family, or we are from our family, but here we are from only the incomes and the experiences. We can't proceed the career over here. But see, the baseline is strong here. We are earning a lot of money, and we can prepare for some. If someone wants to go to USA, USMD, they have a lot of money and they can support their economy and they can do the USMD. If someone wants to go to the UK for the club, AMC similar, Canada, they have a lot of money in their background and they can do anything they want. They will not have like a economic stress which we used to have in Nepal. Okay. So that is the best thing. But career here we can't proceed the career here. Okay. Now, just like, can you give me a short answer on how easy to adapt with the electronic medical record EMR system?
question?
That's the best question. Yeah, that was going through my mind. Okay. See, in Nepal we used to do the paperwork all the times, and okay. I don't think that it is going to come the EMR system in Nepal very soon. I think it will come after 10 years. But here, initially we had some difficulty to deal with that, but as the time goes on, we are totally experienced, and I'm really enjoying with the EMR systems. Because see, the world is changing. Yes. So you are getting like quite better advantage of technology. Exactly. So the last question with the Dr. Mohan.
Okay.
So if a medical officer working in Nepal and desiring to work in Oman, so what advice would you like to give to them?
Yeah, if someone wants to come here as a medical officer, this is a good, very good opportunity. Okay, it will help to build your career as well because, as Dr. Nandan told here, that it's no career development at all. As if you Oman do not hire you for post graduation, but the good point is you can earn money. You get enough time to study, like lab, USMD, AMC, everything you can do it, and you can even earn a good amount of money with your good personal life, good enjoyment. Everything is possible here. Okay. That's why it is. I highly encourage you, doctors. If you want to come here, that will be the good opportunity to build your career future ahead. It's a good enough time to study, good time to save money, good time for your
Exactly.
personal life.
You told that we have to work here only 35 hours per week and 5 days per week. So see the difference from Nepal where we used to work 80 hours, 100 hours a week, and here only 35 hours. We have a lot of times and a lot of money. So Dr. Nandan, also you are also recommending medical officers in Nepal to work here in Oman. Obviously. And doctors come and work over here and see the difference.
Yeah, it's very good.
And then doctors like, do you guys miss family? Like while working on?
Of course, we were coming here. We really miss our families
Okay.
because being apart away from family is a, of course, it's a common thing. We miss the family, but we have opportunity to go to Nepal every 6 months. You can go. We have paid annual leave for 48 days in a year. You can take twice or thrice annual leave per year. So you can go every 6
Yes.
months or you go every year. That is not a big issue.
See, from my point of view, what I think that if you want to gain something, you have to lose one thing.
Okay.
Yeah. Without losing anything, you can't gain anything.
Yes.
So obviously, we are all the people who are working abroad expats are like missing their families. But at the same time, you are earning, you are making a baseline is strong.
Okay, so at the end, I think the both Dr. Mohan and Dr. Nandan, so they both had like recommending like a woman is better working environment in terms of salary, in terms of having like enjoyment, in terms of growth opportunity, like more study time here, and then after obviously you will get the international working experiences, and sometimes it's thrill and adventurous to working foreign country as well.
Yeah.
Exactly.
So-
And the main point is the safety.
Yes, and
So,
work safety
yeah,
also.
Work safety, see?
So at the end, so thank you, Dr. Mohan and Dr. Nandan, for your invaluable time, and thank you for some advices that you provided to our audience. So thank you so much, Dr.
Thank you so much. Thank you.
Thank you,
so much.
Sunil. Dr. Sunil, you invited us.
Okay.
Okay.
Thank you
Invited
so
us.
much.
Yes, guys.
Right.
Yes.
Well, enjoying, huh?
Enjoying.
Bye bye. Thank you.